With the COVID-19 situation here in South Korea, the number of new infections is up slightly compared to Monday, when we saw relatively low figures due to fewer tests being carried out over the weekend.
There are also mixed reactions to the government's decision to partially ease social distancing measures for the next 2 weeks. For more, our reporter Shin Ye-eun is here in the studio with us. Good morning, Ye-eun.
Good morning.
So let's start with the infections for today.
Well, Mok-yeon, we're expecting to see the daily COVID-19 caseload reach 270,000 because up to 9 p.m. on Monday, 259,636 infections were already logged. Now, this is a jump of more than 131,000 from the same time the day before. And this isn't an exponential jump, so we won't need to be wary of a second Omicron wave. Authorities actually said Omicron is being contained as we saw the average daily caseload for last week stay between 280 and 290,000. Now, this is a big decrease from a month ago when the average surpassed 400,000. We're also expecting to see a downward trend in terms of the number of severely ill patients and deaths this week. After seeing the numbers of critically ill patients reach 1,315 last month, figures have come down to the 1,100 range. The daily death toll is also coming down compared to last month when the weekly average reached roughly 360, and authorities had once worried that the average weekly deaths might go up to 800, but this most likely won't happen. Experts attributed this to be due to low fatality rate associated with Omicron, and because authorities have shifted antivirus measures to focus more on treating those at high risk, whether that would be providing them with COVID-19 pills or providing in-person treatment.
Now, because the Omicron surge seems to be subsiding somewhat, South Korea on Monday revised down some of its social distancing guidelines. But what has been the public reaction to this move?
Well, right, as you mentioned, from Monday, authorities partially eased social distancing measures by expanding public gathering caps to 10 people and extending business operation hours to midnight. And many hope this will be the final round of social distancing measures before all antivirus curbs are lifted completely. I went to the streets of Gangnam yesterday to hear what people had to say about the latest rules, and the average Korean had mixed reactions.
I didn't even know they eased measures again on Monday. I don't think it's that significant anymore either because antivirus measures have changed way too much.
I'm happy that I can meet my friends for an extra hour. Because back when restaurants and cafes could only open till 11 p.m., some of my friends who lived far away had to go home really early or couldn't even make it.
The business owners I talked to said they would have preferred if all measures were lifted completely. More specifically, they hoped there wasn't any sort of curfew. Take a listen to what these restaurant owners had to say.
While restaurants and cafes may stay open for an extra hour, this doesn't mean they will be able to operate. Most employees who use public transportation have to leave before midnight anyways because there aren't any subways or buses that run late into the night.
I hope the authorities will soon ease all distancing measures because business owners like myself are way too exhausted. We can't endure this situation any longer.
Yeah, so we will have to wait and see whether the government would scrap more of these distancing measures in the coming weeks. But until then, authorities seem to be considering more ways to return to normalcy. Can you give us the details?
That's right. With COVID-19 increasingly being looked as becoming endemic, authorities in Korea are considering shortening the number of days an infected person must stay at home to recover from the virus. As of now, those infected are required to self-isolate for 7 whole days. Officials have also made local hospitals and clinics provide in-person treatment. They're also thinking of allowing infected people to visit pharmacies themselves to pick up their own medication. Now, this is currently not allowed. For people living alone without anyone to pick up medication for them, local governments have been providing delivery services. Also from today, the set price on self-test kits will be lifted. The Ministry of Food and Drug Safety had fixed the price of one kit at 6,000 won, which is around $5 to stop price hikes and stabilize supply. Authorities had also ruled that the sales of such kits be strictly offline at pharmacies and convenience stores only. Now, this measure will last until the end of this month.
Right, that's something new. Ye-eun, thank you for the report. We appreciate it.
Thank you so much.